very good evening, everybody, and welcome to another episode of Eclectica The Different News. Today, we are going to talk about a very interesting topic, that is AI in oral medicine or oral radiology. So, I have an expert and a friend from US, and I will introduce you to Dr. Pallak Arora. Well, before I bring in my guest, let's see who is the expert in the room. So, Dr. Arora is pursuing her residency program in oral and maxillofacial radiology at the Texas A&M School of Dentistry and is on track to graduate this month. She began her dental career with a Bachelor of Dental Surgery from Divya Jyoti Dental College in 2008, where she also served as faculty for a few years. She completed her Masters of Dental Surgery (MDS) in Oral Medicine and Radiology in 2012 from Rama Dental College and Research Center, India. She has presented many research papers, posters at national and international conferences. She authored and co-authored around 50 publications in prestigious journals. She received the Best Scientific Poster and Paper Presentation Awards in the National Conference of IAOMR. She is affiliated to numerous organizations like Indian Academy of Oral Medicine and Radiology, American Dental Association, American Academy of Oral and Maxillofacial Radiology, to name a few. She has received prestigious Howard Draper Award in 2022, sponsored by American Academy of Oral and Maxillofacial Radiology. She has been invited to present numerous lectures, seminars, and continuing education courses. She did and continues to avidly participate in a wide range of research related to oral medicine and maxillofacial radiology. She is interested in advanced imaging, radiation biology, clinical trials, and oncology. Well, I think it's time to call in my guest today, and we will have, as I said, a very interesting conversation. Hi, Dr. Pallak. Thank you so much for accepting my invite and being on Eclectica The Different News. Very nice to see you and have you on this episode.
Hello, Gargi. Thank you for such a comprehensive introduction. And I'm indeed privileged to be on this platform today.
Thank you. So I think, Pallak, we have a lot of things and a very interesting area that we are talking about, and the trending topic that is AI or artificial intelligence for that matter. And you being a specialist in oral medicine and radiology, so I think I have a lot of questions to ask you, or probably some myths to break, with your insights with AI in oral radiology. So, well, before I go into my questions, I mean, your journey is very interesting. So, can you just tell us that how, what made you go abroad, or probably you have already done your MDS, you are working as a faculty. So, what is this all about? Which was going on, and you took a stride this way. It would be very inspiring to know from you.
Yes, sure, Dr. Gargi. Actually, I'm originally from India, and when I was in my undergraduate program, the subject of this oral medicine and radiology was introduced, and it captivated me completely. I think I'm really passionate for oral diagnosis and healthcare. So I pursued my MDS in oral medicine and radiology. And then I just wanted to increase my skills and efficiency and dexterity, and I migrated to United States and wanted to continue my passion, wanted to serve the healthcare sector. And so I just sought out admission in Texas A&M College of Dentistry in a residency program, and I think I'm fortunate enough to have this opportunity because my mentors here are really very kind, and I have learned a lot of skills for the interpretation. As you know, digital radiology has a lot of advancements recently, which helped me to gain more attention in this area. And I can now interpret those lesions. I just got a chance to meet the neuroradiologist in this field, and this was a great opportunity for me.
Great to know that. I think you have been following your passion, and that's the right thing. I mean, whatever you have taken the step is the right thing to do. How has artificial intelligence impacted the field of oral radiology? Like, if you can give us some examples where specific AI applications or technologies that have been made some significant difference, that would be great.
Yeah, sure. So, we all are aware that artificial intelligence has been extensively applied in broad range of industries today. So, oral radiology is no exception to this trend. We have numerous applications of AI in oral radiology, like dental charting applications, detection of dental caries, periapical lesions, assessment of periodontal bone levels, say it's localization of landmarks, orthodontic landmarks on 2D or 3D images, and TMJ disorders, and a lot more like fractures. Apart from diagnosis, I think there are some other areas like improvement in the image quality through AI tools, as well as image recognition, which normal human eye may not be able to diagnose. These are certain arenas, I think, and it looks quite interesting.
Yeah, definitely. Whenever it comes to AI, since it's about adoption of a technology, so probably can you tell us like kind of challenges and probably limitations in implementing AI in oral radiology, and how do you see these challenges being addressed in the coming future?
I think it is a great question. In my opinion, I think there are a lot of challenges as well, because every technology comes with pros and cons. So the biggest challenge I see today is, large number of data sets are required for the application of successful implementation of AI. And sometimes it is quite cumbersome and time consuming. Also, high quality data sets are required. And supposedly, if I apply the AI application on smaller data sets, so the information may not be appropriate. So it limits the generalizability of the application. Apart from that, I also believe that this application is localized and contextual to like the system it is applied for. Like I have applied it in one hospital. Then if you want to go and work for the same program in the other hospital, it might not work. So there are certain challenges, and I believe that even radiologists need to strengthen their experience in this field before they participate in these applications, because proper annotation, labeling, and data tools are required. So this would help them for the proper implementation of the AI tools.
Right. Thank you, Palak, for that answer. In what way actually AI can help us in the diagnosis and treatment planning of oral diseases and conditions? Can you share any success stories or research findings that actually shows the effectiveness of AI in this particular perspective?
Yes, sure, Gargi. Actually, I would like to introduce a early use of artificial intelligence long back in 1995. Dr. White from UCLA School of Dentistry, he introduced an application called ORAD. So, for the diagnosis of oral and maxillofacial diseases. So, a user needs to enter the clinical findings and the radiographic features, and a list of differential diagnosis is generated. So this was the early use of artificial intelligence, and I believe since then it is evolving. So I think other areas like it can definitely revolutionize the field of oral cancer, early detection of cancer. Recently in the Massachusetts General Hospital, a software called Sybil was introduced, which detected early cancer, and it can save human lives. Also, AI, you can, with the help of these AI tools and the deep learning methods, you can categorize the patients into high risk and low risk. And this might further help in the treatment planning for the oncologists, like, whether to go for a conservative approach or to go for a radical treatment.
Right. I think there's a whole lot of scope that lies ahead of us, and already, as you mentioned, these new advancements, or like it's not very new, but it started long back, and I think, as you rightly said, it is evolving with time, and I think the evolution is very fast paced.
Yeah,
That is what we see nowadays. Yeah.
right.
So well, how this AI would, particularly today we are talking in terms of oral radiology, how you think would be the benefits of using AI in case of both patients and the healthcare professionals? So, is it something like that AI could help us in improving efficacy or efficiency? I mean, what would be your opinion in this matter, Palak?
Yeah, I believe it is a valuable tool. In my opinion, I think it is not going to replace the radiologists, but definitely it can improve the efficacy, decrease their workloads and efficiency, and moreover, with minimal incremental costs. And also, especially, I believe in the administration part, maintaining patient data record is tedious. And, implementing the AI tools with the EMR records makes the work of any radiologist very easy. And they could focus more on the compassionate patient care. So this is like one of the greatest benefit. Apart from that, virtual patient care can also be dealt with this technology. These
Yeah.
are, I think, in my opinion, the benefits.
Right, and rightly said, like because in during COVID we saw that how important the virtual dental consultations, like teledentistry, was kind of something which
Yes.
also came into picture. You
You
know,
know what? I would like to tell you one more example. I was reading through some of the systematic review. A study was
okay.
conducted by Ravi et al. In 2022. And, according to that study, this AI tool has accuracy of 74 to 99.2%, especially while when you are using the deep learning methods. So deep learning is a subset of machine learning. So it has a great accuracy. I think, isn't it fascinating?
Yeah, yeah, definitely. It's very fascinating. So I think the it's just matter of time that the challenges that we have, and because as I said, it is very fast paced, and I'm sure as an expert in this domain you will know better. So I think it's just matter of time that we are adapting to these new things, and we are envisioning a more brighter societal health for that matter. So, so Palak, my next question is that. As a researcher in the field of AI and oral radiology, what are some of the current areas of focus, or per se, like, or ongoing researches that you particularly find very promising in this area?
Again, I have already mentioned, I feel diagnosis is the one area, like it is going to help a lot in early detection of lesions. Like in one instance, there is recently a study going on where the authors have decided to differentiate between a periapical granuloma and a periapical cyst. So sometimes on panoramic radiographs, radiologists do confuse with this entity, and basically, but the treatment is different from for both of them. Like granuloma may simply be treated by an RCT, whereas cyst we require a surgical treatment, whether by a enucleation or marsupialization. So they found that using those deep learning models, that the accuracy was 96%. So these are certain instances, where it can definitely help in the diagnosis part. And I believe apart from diagnosis, even in improving the image quality, it can do wonders, because when we acquire the CT or CBCT images, patients like motion artifacts or movement may cause some artifacts, and there could be noise and scatter. So these AI tools are now being used in improvement of the image quality and better interpretation reports.
Great, great. When it comes to AI or anything for that matter, we are implementing in terms of healthcare. So there are ethical considerations that are crucial in this aspect as well. So, what are some of the challenges, ethical challenges specific to AI in oral radiology, and what do you think that how they could be addressed in terms to ensure patient safety and privacy?
Yeah, right. I mean, yes, there are a lot of ethical challenges with AI today. Supposedly, as I mentioned earlier, that sometimes it may not be intelligible to humans because, supposedly if you are using smaller data sets, the information may not be very accurate. So it may not be very transparent. Apart from that, recently some studies suggested that there could be manipulation of the data using these deep learning methods. Like there were cancer patient images, which could be either you can add the images or delete the images from the DICOM system. So I think this is a serious concern. I mean, for patient security and privacy issues. And I believe that a lot of work needs to be done, like we need to strengthen our DICOM imaging system so as to basically get more accuracies.
How do you envision the future of AI in oral radiology? I mean to say, specifically, I would be interested to know if you see any emerging trends or advancements that you believe that it will have an significant impact in the field.
Certainly, I believe that it has a promising future in various arenas, like especially for early detection of cancer, early detection of oral diseases. The other point I would like to address here is I see some of the very emerging trends like AI with genomics. So, genomics is a new area, like it is similar to molecular imaging. And the main goal is the early detection of the lesion, like combining the AI tools with blood or biomarkers for the early detection and thus enabling a customized treatment plan. So this is one area. Other emerging area I find it interesting is AI in radiomics. So what is radiomics? Radiomics is just the integration of those images with data algorithm tools. And you can just, with the help of segmentation and pre-processing, you can just archive or get high dimensional images. So these images can further help you for cancer detection, early detection of metastasis. So these are certain trending areas, and we all are aware of AI with robotics these days, chat GPT. I think these are some of the emerging areas.
Great. I mean, it's very interesting. Yeah, genomics, yes, that's something which I'm very passionate about. And thank you for bringing that up. Just that since you had a career, you started in India and then now you have also worked as a faculty. So you know both the sides of the chair as a student and as a faculty. And then now you went following your passion to the US to, uplift yourself more and take a stride in that aspect. So, see, Pallak, what I generally hear in India, and probably you as a faculty who have worked as a faculty would also perhaps agree with me that there is a myth which runs in the dental industry at this moment that dentistry is dying in India, and it's so much of saturation, and many people. It's kind of not a very positive environment for dentistry. So in that context, and this is a question which I asked to all of my guests, like before leaving, is that seeing you and your achievements, it's very inspiring. So what would be your message to the aspiring dental students or probably the future dentists? What would be your message? Because I think that's very much necessary for
Yeah,
them.
I think it's a very good question actually. So I think, as I mentioned earlier, that these tools, AI is not completely going to replace the radiologists. It is just going to help increase the efficiency and productivity and help you to provide more compassionate care with less of tedious time, less of time. And so I would just give them a message like, if you are really interested to pursue the research in this area, just give some time and understand the concepts of machine learning and deep learning, and there are different algorithms. Try to understand them. So because we have a robust lack of robust clinical trials in the live clinical settings. So if you go and learn about proper annotation, labeling, so that you can properly implement these tools this is a great help for future exploration of this tool further.
Thank you so much, Pallak, for your time. It was wonderful talking to you today, and I think it was a very insightful and exciting episode. I'm sure all audience who are listening to us now, or probably would be seeing this video later, I think they have got a lot of insights. So,
Yes.
yeah, I think
Thank
thank you
you,
so much.
Gargi. Thank you for inviting me for this wonderful opportunity.
Great. So, to my audience, stay tuned with us for another episode of Eclectica next Friday. And I think this episode has enlightened your mind in terms of AI, in terms of dentistry as a whole, and in terms of how AI would be. It's not future anymore. It's just here, right, Pallak? If I am not wrong.
Yes, true.
Yeah.
We are
Okay.
looking forward, for more innovations.
Thank you so much, Pallak. Thank you once again.